Today is Wednesday, July 12th. Yesterday I got my surgical procedure done to get rid of a 4 centimeter piece of my colon that was around the, the size of a little TV, power cord or things, 4 millimeters. That really caused me not to be able to digest the food properly and lose a lot of weight and caused a lot of stomach and bowel issues for 2 years. The good news is I hurt myself and I started bleeding, and they did a colonoscopy and found out that I had that piece, and means that it's been removed, and I'm just in the hospital recovering. But around 11 o'clock today, par for the course, I started spiking a fever. 100.5. They gave me Tylenol, and then I was 101.7. They gave me more Tylenol, and then I was 102. So they're doing all kinds of tests to try to figure out. Typically, after surgery, there is some fevers associated with it in the abdominal section. So I am dealing with that. Every test that they've done so far has come back negative. They did an X-ray, so um, they're in the process of eliminating, what the causes could be. So fever and the pulse rate is super high, and I think the pulse rate super high is just from the pain of the surgery. Um, when I cough, and they said I needed to cough. Um, and since I had radiation and tumors in my lung, I always produce phlegm that I cough up every morning. But since I was in the hospital, I didn't do anything to make myself cough. um, so I made myself cough. They took a piece of that sample.
Hey Jorge, what's your date of birth?
Good.
Oh, sorry.
So they just asked for my date of birth, and they took it off. But the good news is I got a nice room now. Yesterday I was in a room with a roommate, and I was not in the right wing, the right floor that handles surgery patients. So I got moved upstairs to the third floor, and they specialize in recovery from surgery. So I have good nurses, good doctors taking really good care of me. My wife is here. So just calling to let you all know that it's kind of bumpy. I was so happy in the morning until I got my fever, and then it just totally depressed me, and I felt like such a failure. But you know, they haven't found anything yet, so we'll see when that fever breaks. I think it's the fact that I'm just laying flat in bed and not able to walk around and do my normal thing. I haven't had a fever, so it's an interesting fever. So um, disappointing, but I've been through this rodeo before. That I have a fever and they can't find the cause of it, so they send me home on antibiotics for 15 days, and this just covers everything, and that clears me up and anything that I had. So hopefully the cough sample makes good samples, and they can let me know what's possibly causing it, or if it's just clean. What else? Um, that's it. You want to see the scars? I'll show you the scars.
Hey, Shannon. I gotta shove something up your nose. I gotta shove something up your nose. Are you trying to take a